Epilepsy is a very common condition. It's as common as diabetes, if not more common in children, which is often an unknown fact. The trouble is it's not one disorder, it's more accurately the epilepsies, and it has many different presentations, many different causes and many different treatments, which makes it a little more complex. As we determine more causes, then we're going to be able to target our treatments with imaging. If we find abnormalities of cortical development, particularly if they're on one side, then we may consider surgery where medicines haven't worked. And of course, in the genetics, if we find the genetic abnormality, that can give us a cause. We may be able to target that cause with a very specific treatment, maybe one that we've not heard about before. Usually children who present with seizures in the first year of life have a very poor prognosis for either seizure control or indeed neurodevelopmental outcome. And what we want to do is try and improve that neurodevelopmental outcome and improve seizure control. So this study will recruit all newly diagnosed children in the first year of life who present with epilepsy in the southeast of England. They will be evaluated from a clinical and a neurodevelopmental point of view, and they will be followed sequentially. So what we want to do, and why we feel this research needs to be done, is we need to know, whether we can predict who's going to have good or not outcome, get more information on what treatments may be effective in order to move forward in possible other clinical trials. I think for the children within the study that we are about to embark on, the main difference will be getting a diagnosis with regard to the underlying cause of the epilepsy. This may lead to earlier consideration of other treatments, maybe not necessarily routine anti-epileptic drugs, but that may be a benefit we see for the future, for future children with early onset epilepsy.